think let's just finalize taking our selfies and so that we can settle down. We'll give you a few seconds to finish with to conclude important selfies. They are very critical, very critical. You don't know what one selfie can do to an event. You might find that you are going to trend and make this press conference a trend as well. So we must not take it for granted. Ladies and gentlemen, esteemed guests, members of the media, stakeholders, thank you very much for agreeing to our invitation to be here today. We invited you as part of a program of ongoing engagement with the members of the media who are the critical conveyors of information that bridges the gap, if there is any, between the public representatives and the public through information dissemination, and the stakeholders who represent various sectors of our society, and those that specifically relate to the cluster that will be engaging with you today. We are grateful for your presence. We know that some of you have traveled from outside of Cape Town. Some of you have driven from various parts of the Western Cape in this cold weather. We don't take that for granted. We thank you for braving the cold weather to be here so that you can engage with your parliament, because we believe that it is through this kind of discussions between the chairpersons who represent the oversight committees of parliament and yourselves representing various sectors of society that we can find solutions to some of the pressing problems affecting our country, because parliament is elected to find solutions to the problems of the country, service delivery, and so on and so forth. So one step at a time through these conversations, we are making a dent on the problems that face us as a country. So thank you very much. You are all welcome. From the start, perhaps, is to apologize that when we invited you, we said that you will be addressed by or engage with the 4 committee chairpersons. Unfortunately, we had a last-minute apology for reasons that are very real and sound from Chairperson Liesl van der Merwe, who is the chairperson of the Portfolio Committee in the National Assembly of Women, Youth, and Persons with Disabilities. So we apologize that she will not be here because of a sudden occurrence of a commitment that she could not get out of. But she has wished, well, she would have wanted to be here to engage with you, but she has wished as well in this engagement. So we do have the chairperson of the Portfolio Committee on Health, Dr. Sibongiseni Dlomo, who will, in his presentation, address issues of tobacco products and electronic delivery systems control bill, Operation Dudula, and their involvement in the healthcare centers around the country, especially that is Gauteng mostly. And then you will also be addressed by the chairperson of the Select Committee on Education, Sciences and Creative Industries in the National Council of Provinces, Mr. Makifeni, who will deal with issues regarding threat of disruptions of schools when they open next year on account of foreign nationals, exploring better ways of working with all civil society organizations on foreigners, as well as legislative interventions, including labor migration policy and border management authority. Those are the critical issues that we'll deal with. And then finally, we'll conclude with the Honorable Chairperson of the Portfolio Committee on Basic Education, Ms. Joy Maimela, who will deal with Bella Act regulations and issues relating to safety in schools. So thank you very much. Without a waste of time, I'm going to invite Honorable Jomo to give the opening presentation on his committee issues. Yes. You can come here for the initial presentation, but when we deal with the questions afterwards, we can take them from there.
Okay. Thank you very much, Mr. Mlot. Good morning to our media houses that are invited here, to our staff members of Parliament and our stakeholders who are here invited. Recognition to my two chairpersons that I have already greeted outside, but and also got a bit of a directive that because this is a month of women, Honorable Maimela will speak last, and we then agreed that she will take almost all of our questions because it's a month of women. We must give the recognition to that. I will probably deal with two items, but the third item might just come in because it's topical, the issues of NHI as an act. Of course, part of it in terms of explaining the issues of what has been happening with Dudula will be touched on that. Let me just start with the process that is Tobacco Products and Electronic Delivery Systems Control Bill. This bill was actually brought into Parliament in the 6th administration. Actually, I was privileged to have brought it myself as a Deputy Minister then to the Portfolio Committee on behalf of the department, having gone through what it has actually supposed to Cabinet, and then NEDLEC, and then came to Parliament. So the process started in 2023. At the completion of the 6th administration, the Portfolio Committee had not completed the process, had done public hearings on 7 provinces and had left with 2. So in this new administration, as a chairperson, I led a committee that completed those 2 other outstanding provinces. We were doing 4 meetings per province. And there was Northern Cape and Western Cape that had 3, so we had to complete 1 each. So that process has now been dealt with and is behind us. While we're going into the provinces, we then learned that there were about 60 organizations, institutions, and individuals who had requested to make oral submissions to the Portfolio Committee in the meetings that we normally have thereafter the public hearings. That process then kicked in, and next week we'll be completing this. In fact, if you release me much earlier, at 3 o'clock today, I start with that process of virtual meetings. We are going to listen to 5 other institutions today, and then we'll complete that process hopefully by Thursday next week. So we'll then be having all that part sorted out. What will then unfold thereafter will be the Department of Health to say, Department of Health, come and actually indicate to us what are your responses. Because all along we have been with them in all these public hearings in provinces and also with these ones, they have to actually now indicate what are their responses in the light of what we have been hearing. We will then, having listened to them, get into the process that is called clause by clause, looking into the bill in the month of September, clause by clause. So we are almost like panel beating, finding the views of South Africans and those who have participated, actually because the product that was brought to us by the Department of Health will probably be amended through these contributions and suggestions by our citizens, and hopefully by the end of September, this bill should then be ready to be taken into the House for debate and also then be voted on for or against. If this bill then gets voted in as supported by the majority of members of Parliament, National Assembly will then take its route into the National Council of Provinces for that other process. So really a bill that has been in Parliament since 2023 and is really urgent because some of the people we have met are saying, please regulate us. We need to be regulated, mainly those who are in vapes, because partly this bill is improving what is there about tobacco, cigarettes, and all that, but it is actually a new thing that we have never seen before. Issues of vapes, hookahs. This act that we have does not cover that part. So we are looking forward to really fine-tuning this bill so that we can begin to really get into regulations of these vapes and other hookahs. Right now, we just leave them as they are. Nobody touches them. They do as they wish. And I think that is something that we need to be dealing with that very strongly. Now, let me then go into the second part, which is really dealing with the issues of not only Dudula, but generally speaking. When you look into the preamble of our constitution, it talks about South Africa belongs to all of those who live in it. Now, that part to be respected and that part to be acknowledged, but this part all, how many and who's all? So I'm not a lawyer, so I won't get into that. It could actually be argued. Then Section 27 of our Constitution again talks about everyone has a right to health care services, including reproductive health care. We were confronted by many stakeholders during the NHI public hearings on that part. And hence the conclusion of that part was to say, but the country will and should give emergency health services, not what will be for all South Africans a comprehensive healthcare services. So it means every citizen coming into a facility, citizen of the world, can only be afforded emergency medical services, which is probably what is binding us based on United Nations rules and all that. But the comprehensive part is that is not probably where we come in terms of support and to do that part. So I am glad that over the past few weeks, the Minister of Health has been discussing with the concerns of Dudula and other stakeholders who have brought this matter to our attention as a country. And our discussions, and also which then have come to be done by myself and the Minister of Health, is that these concerns cannot be ignored, brought in by these citizens. These concerns cannot be wished away, but maybe we should find an approach to handle them and going forward. And the discussion, therefore, going forward are, among other things, to address those issues. Fortunately, I was speaking to the minister who has just been a Minister of Home Affairs in the previous administration. And he mentioned the following, that there are certain acts that needs to be repealed, but bringing a bill into Parliament from the Home Affairs Ministry. One, a Citizens Act. I won't go into details there, but it means that part of that act talks about citizens being a very wide spectrum. I mean, South Africa is this side of a country. You can't have citizens of the world accessing services in the country the way. So that part must actually be looked into. The other two, that one was in 1993, and the Refugees Act of 1998 also needs some repeal through the bill. There's another one called Identification Act, I don't know much about that. I was trying to speak to my Home Affairs chair this morning, as to what is the content of this acts, but I'm just raising it because the media might go and look and see what are these acts. The last one is Immigration Act. So some of these acts are very wide and encompassing what some of the people are in their views are saying. Maybe they should actually have a bit of limitation. We would have, it's not possible for us as a country to have unlimited resources to deal with what is there in the world. But however, the engagement with Dudula and other stakeholders, you say, look, while there are concerns are coming in from this background, because it's true that there are sometimes clinics and hospitals where there's not enough medication, this and then long queues. But the other thing that makes us to say, maybe let's actually streamline the approach. If there was to be a fire in any of our informal segments, God forbid, but we also know that every time there's another fire, this and that, most of those citizens lose their identifications, their IDs and everything. So you'd also be saying to other South Africans, you are legitimate South Africans, you don't have access into this facility unless and until you produce an ID. It doesn't matter your ID was burnt in the fire last night or last week. So in terms of that, therefore, those are things that if you engage with Dudula and other stakeholders, you then find a process to say, let's start. So it is something, because as healthcare workers, they can't just stop today. We don't take you unless you show an ID. On the basis of what I've just said, there could be as well another South African who is legitimately supposed to come in there, but the ID is not there. But number two, this part that is this person, foreign national coming in for the emergency medical services, me at the gate, I may not be able to ascertain that part. But let me end with this part. Even us as South Africans, until this NHI Act gets to be really moving, there's only two groups of South Africans who are actually getting free medical services. It's what was announced by President Nelson Mandela in 1994 in his very first State of the Nation, where he says, one, all pregnant mothers will access primary healthcare services free of charge. All children under 6 years will access primary healthcare services free of charge. And we can tell you of the huge benefits of what that has done in our country. But all of us, until we have really put all the issues that do with NHI, we still have to go to Chris Hani and pay if we actually are able to pay and we are working and pay for the service that we receive. But even if we have now got an NHI in place and we say it's free, it is free at the point of service. There are South Africans who will contribute to the fund and NHI, so there's nothing completely free. It is free at the point of service that will not disadvantage South Africans who will come at the point of service, but all of us will have to register, give support, and therefore be able to contribute to the fund. All that it will happen now that at the point of service, I'll have to produce my ID to say we are Smokseni Lomo. Yes, you are registered. Now get in there and then you get the service. So we'll still have to actually do that. So you may just say NHI is coming in for free health services. Yes, at the point of say, but there are South Africans who are going to contribute through tax to make sure that we realize a universal health coverage for all of us in the country. Thank you very much.
Thank you very much, Honorable Chair Dlomo. I wish now to invite the Honorable Chairperson of the Select Committee on Education, Sciences and Creative Industries, Honorable Ben, to give a presentation on behalf of this committee.
Thank you, Chairperson of the session. Let me take this opportunity to greet the media house, the staff of Parliament, the stakeholders that are within our midst, also those who are in our different social media platforms, and also my two honorable chairpersons that are within our engagements today. Let me take this opportunity once again to extend also my greetings to all South Africans who are with us. Today, Honorable Chairperson, as a select committee of Education, Sciences and Creative Industries, we are here to clarify indeed and also just to brief in terms of the statements that we have echoed around the operations of Operation Dudula, specifically on the question of the threats that they've made to our future, which is our kids, when they were threatening that they are going to make distractions in our 2026 school year. We as the select committee are very clear that we will never accept that kind of distraction to take place. We do not believe that when we want to make things right, it's the way of an approach. We therefore condemned with the utmost contempt those forms of threats and actions to be. We are convinced that there is nothing that can be gained through those forms of actions, but there must be ways of ensuring that there is a cooperation. It is informed by our understanding, indeed, of what becomes the role of a civil society organizations. Because if you're identifying yourselves as a civil organization, you must be able to understand your footing so that you do not violate the rights that have been entrenched in the Constitution of the Republic. South Africa is not a banana republic, but it is a constitutional democracy governed by the rule of law, which is my former chair, when he was making a presentation, highlighted that our constitution is the supreme law of this land. This is Section 2 of that of the Republic of South Africa. Then what becomes the role of these important civil societies? It is to safeguard, make sure that it protect and also act as a watchdog of those rights. Make us as politicians to be accountable to that constitution. So this approach, that is why we're saying that we do not agree with this approach. How are you defining, how are you identifying a child that is not documented or is illegal in this country? Because an undocumented child, as already been highlighted by Doc, is not automatically illegal to this country. I think you didn't do that if you are just going to take a blanket approach of distraction. As has been highlighted by Doc, that there are the various issues that led to those kids not to be able to have those necessary documents. You can name them. It's a plethora of those issues that can be highlighted, but the simplest one is highlighted not to lament. It's when documents are burned or are lost. There are processes that must be followed in order to ensure that you get your necessary documentations. So at the time when we are embarking on that destructive and unwelcomed behavior, as highlighted, how are you going to identify that? We don't know. Hence, we're saying that that is not going to be the case. We're not going to allow anarchy to coexist with governance. If any form of anarchy, as this operation Tutula is highlighting, they are prepared to continue with that, even though we are extending a platform to say, let us engage, let's sit down, because there are different approaches in anything if we want to cooperate and contribute to this constitutional democracy. So we are putting ourselves so that we can be able to engage with them. Our kids cannot. We are not going to allow that to happen. About, if I'm not mistaken, 6 million South Africans that are legal. I'm talking about those that are South Africans and do not have these necessary documents, not because they are not South Africans, but they do not have these documents. How are you going to separate them if you are going to say that at the point of entry, you just dismiss everyone that is suspected? Because you will be using now a funny approach of sniffer dogs, because there's only sniffer dogs that can sniff the illegal substance at airports. So we are not going to allow that kind of a behavior. We believe that there must be processes, there must be engagements so we come to a proper solution. So that 6 million that we're talking about, it's about 11% of the population of this country. I'm not talking about those who are here for different reasons. I'm excluding, I'm not talking about those. I'm talking about only South Africans now. Only South Africans. So it tells you that we have challenges, but government is dealing with those challenges. If you're talking about the question of borders, there are legislations that are dealing with that. The question of immigration, the question of following up all of these critical issues that have been highlighted, you see. And also the new legislation that we have just passed. I'm not going to be expatiating on it, but those that are dealing with the governing of our schools, Bella Act is clear on undocumented kids. We're talking about the future of this country, talking about the government that is looking after the future of this country, that must not at any given moment find violated, because it's a violation of those children's right, regardless of how are they in this country. Bella Act is informed indeed by different court judgments, court orders. So as people, as citizens who are respecting the rule of the law, we embarked on this process of ensuring that there is one legislation that governs our schools. So I'm inviting Tutula people to familiarize themselves with what is constituted by the legislation, what is constituted by our law, specifically, they must visit Bella Act so that they can be empowered. We are here for that. We are going to assist them so that they understand all of these issues that we are raising. We must not even be seen as people who are undermining or trying to be a stumbling block on the general role of civil society. We are clear and we are welcome, as it is also protected by the Constitution, because we want to have those watchdogs so that we do not by any means undermine or find ourselves not implementing what is expected in terms of the Constitution, but we cannot at the same time allow that. We cannot allow anarchy. Therefore, we are saying as a standing committee, if they want to contribute to this, to the building of this nation, they must come to the fore. We are not going to sit down and fold our arms. If they are, if they are the established structures, they want to know how to participate, we are here. We are going to assist them. We will be part and parcel of ensuring that the role that, especially this month, is the month of women. We cannot undermine and neglect, the role that has been played by our forerunners. I'm talking about Mamalini Ngoyi, Itamdwana, Winnie Madikizela Mandela. They created conducive environment for our kids, the future generations to come, to be protected, not to be violated, because the threats on its own to us, it's not seems to be comfortable or accepted. Instead, they must protect those kids. We are not saying that if there are criminal elements that they are identifying who are in the process, they must work with the security agencies. They must bring those to the books. We are not talking about that. We must not be seen as or misunderstood to be protecting any of those criminal as a criminal, regardless of documented or not documented. It must be brought to books, but there are necessary agencies that must work with. Cooperation in this instance is going to assist all of us. That's what we are saying as the select committee, specifically around this question. Thank you very much, Chairperson.
Thank you very much, Honorable Feni. I wish to invite the last presentation from the Honorable Chairperson of the Portfolio Committee on Basic Education, Honorable Maimela.
Thank you very much, Chairperson of our session. And let me stand on the established protocol and pass warm greetings to the members of the media that are here, the stakeholders that have joined us, our support team in Parliament, and of course, the fellow two chairpersons that have presented before you. As already alluded, my name is Joy Maimela. I'm the chairperson of Basic Education. And we consciously took a decision to elevate two issues that we felt it would be important that we address today. One of those issues, of course, is the Bella regulations. As the members of the media and the stakeholders would have seen that the Department of Basic Education has finally released or gazetted 2 regulations out of 8. And of course, they've generated serious interest. They've also generated serious interest from ourselves because as we all know, the intent of the Act is to really ensure that there is accountability because the Act speaks to the roles of the SGBs. It is also to ensure that there is equality and equity in access to education because the Act speaks to admissions, it speaks to language policies, it also speaks to discipline in schools. Now, we have expressed discontent with these regulations. And of course, as a portfolio committee, we've actually been outspoken about this discontent with the gazetted 2 regulations. The first issue or the first area of our discontent is the fact that there's only 2 sets of regulations that are released, and out of 8. And our view is that releasing these regulations in such a manner is going to create confusions because the regulations speak to each other and they should correlate each other. And if you release them in 2 sets, for us, you are actually trying to derail the implementation of the Act in its totality, but also you're just trying to create some confusion. Moreover, because the department missed its deadline for the release of these regulations. The deadline was June, we are now in August and they're only releasing 2. So that is the first concern that we have raised as a portfolio committee, but beyond that, we've said and we've communicated that we're inviting all stakeholders to really engage with those regulations. The second area of discontent is that on admissions, for example, the regulations refer to considering the demographics and education needs of the surrounding community. In the Act, however, in the Act, the responsibility for admission policy is actually given to the head of department. And the Act refers to the education district. However, the regulations now introduces what they call feeder zones that the HODs ought to determine the feeder zones. And we believe that that is not in line with the essence of the principles of the Act, and that potentially reinforces local demographic homogeneity, contrary to the type of inclusivity that the Act intended. The second issue that we really are discontent about is the fact that prior to the release of these regulations, the department tried to enact something called the guidelines. And in our discussions and in our meeting with the 9 PEDs over the past month, the PEDs, 8 out of these 9 PEDs also indicated that this is creating a confusion, and many other stakeholders have come to us to say this is creating a confusion. We have warned as a portfolio committee that the executive should not utilize this enacting of regulations to try and win certain things that they could not win during the public participation process. So there's certain terms that are introduced in these regulations, which are terms that were rejected during the public participation process. And in our own view, that is utilizing the regulation process to try and get other things through the back door by the executive. And we've actually called out to stakeholders to engage and comment on these regulations thoroughly. The other issue, which for us is quite a concern, is the Grade R infrastructure and funding as a critical agency issue. The Act makes Grade R compulsory. And as a result, we have said to the department they ought to come before the committee to actually take us through how ready each and every PED is for the implementation of the Grade R as a compulsory grade. We then, out of those engagements, we realized that there is serious concerns or there is a serious backlog with, one, the infrastructure of Grade R classes, but also the material, the budget availability. and as well the teaching personnel. So you've got a lot of teachers who have been teaching grade R, but they don't have the necessary qualification. And we looked at the plans of the PEDs in terms of capacitating these teachers. And we raised a serious concern about the pace, but we also raised a serious concern about ensuring that the Act is actualized in terms of the grade R capacitation of the practitioners and also the teachers. We are then, as the portfolio committee, making a call to the PEDs and to the department to ensure that they finalize the last set of regulations as soon as possible, but we're also making a call to them to really review the 2 regulations that they have gazetted to ensure that they are really in line with the Act as passed by Parliament. Now, as we move to school safety, we have, as of course, parents, stakeholders, we have noticed that there is many instances of bullying in our schools, violence in our schools. We have seen many social media videos circulating where teachers are being threatened by learners or learners are threatening each other. And that is a great concern for us as a portfolio committee. We've held 2 meetings already, joint sittings with the portfolio committee of police and to engage on how do we improve the school safety. How do we ensure that schooling environments become really conducive, they become safe spaces for our children? Because what we are seeing, of course, it goes way more or way beyond what you would bring as just a set of standard, a set of rules, because of course there is various interventions that we were given an account of, interventions like searching and seizures in schools, but also engagement with learners on how to ensure that we deal with issues of bullying, but also addressing violence in our school. But we're saying that it is becoming a serious problem. And it is a problem that we are going to further engage with the department on how do we comprehensively deal with it, because it requires us to to bring the communities, to bring parents to the table. What we should know is that the school environment mirrors the community outlook. So in other areas, because of the levels of crime in the community itself, that crime escalates and it comes to the schools. So we have engaged with the department, but we're making a call to all stakeholders that this is a conversation that we need to have more comprehensively so that we bring a solution that is sustainable. I just want to speak to the few videos or the few reflections that we have made. That in this month, when we celebrate Women's Month, we're confronted with social media videos of boy learners violently assaulting a girl learner in East London. And this follows hot on the heels of the Minister of Basic Education and the Minister of Police signing the Safe Schools protocols in June this year to enhance safety in our schools. This protocol signifies a joint commitment to creating safer learning environment, addressing issues like violence, crime, and insecurity within our school. Now, as a committee, we call on the National Department of Basic Education to work closely with provincial education departments and law enforcement agencies to strengthen measures that ensure safe schooling environments. Key interventions including the expansion of school safety committees, collaboration with community policing forums, and the integration of psychosocial support services for learners will be very important. We recognize that safety is not about physical security, but also about nurturing respectful, inclusive cultures that protect the dignity and rights of every learner. This requires strong partnerships between schools, parents, learners, and communities. And this is where we would want to end our presentation, to say these are 3 areas that we felt are very important at this current moment to engage with. Thank you very much, Chairperson.
Thank you very much, Honorable Maimela. That is a concluding presentation from the panel. And we enter into now the phase of engagement with your good selves. Normally, it takes the form of Q&A to allow the chairpersons to deal with some of the issues that perhaps requires further clarification from their presentation, but any other issues relating to their committee that they may have not touched on or considered priority given the constraints of time that they have for the presentations. Like I said I know that there are important stakeholders from sectors, NGOs, civil society organizations, forums, organizations that deal with women, youth and children with disability, who were expecting, as it has been promised, engagement with the chairperson of the Women, Youth and Persons with Disability Portfolio Committee. Like I apologized, I said in my introduction that we apologize that he's not here. I think issues can be raised if they are raised, and if the chairpersons who are here are not able to respond to them, we will record them and come back to you with the responses. So we do have our public relations office that will record the issues, any issue that may be raised relating to those matters that I've raised, which the chairperson is not able to respond to because she's not here, and we will deal with them. We'll forward the responses to those organizations. Thank you very much. I start this side as a first round. Any questions to any of the chairpersons? You will be the first one. I'm just going to allocate the numbers and then you will follow in accordance with the numbers that are provided. Any other hand that I'm missing this side? Okay, go to this side. You remember you will be the second one, then you will be the third, you will be the fourth. Say you will be the fifth, and then you will be the sixth, and then seventh. Did I recognize you? Yeah, you will be the sixth. That's the sixth, and then you will be the seventh, and then the eighth, and then the ninth. Okay. Oh, you're coming up. You will be the 10th. Yeah? The last one. Is your hand up? Yeah, okay. In that order. Thank you very much. And then the chairperson will just note the questions relating to them and then respond. In that order. The first one.
Thank you, Chairperson. My name is Patrick Solomons, and I'm with the organization called Molo Songololo. One of the reasons I'm here is because of the threats that has been made against our children and their education and their rights. Now, we have seen these threats being made for many years now, and we haven't seen a decisive response against that by our government or this parliament. We have also witnessed ministers, parliamentarians, politicians echoing these threats in various different kinds of ways. And my question is, what is this committee and parliament doing to hold our elected officials to account? They are echoing these threats on the rights of our children. Our children do have a right, all children in South Africa, whether they're South African children or foreign children, they do have rights. And they do have rights to social services, to education, to health. And all of these rights must be respected. We are a member of the international community. We are a signatory to the United Nations Convention on the Rights of the Child and many other treaties to protect our rights, to protect our children's rights, and to protect all children's rights. But the very people who are supposed to uphold these rights, our elected officials, are threatening these rights by their utterances, what they say in public. So I'm very disturbed that this parliament, so far, to my knowledge, haven't held anyone to account. I'd like a response to that. Why is that so?
Okay. I think we got the question. Let's try to be brief so that we can accommodate as many participants as possible. Confine ourselves to a question. Second one. And number 2.
That's me.
Yes. Okay.
I have 3 questions, one on health, one on the schools, and one on the last speaker. So, chairperson of the health portfolio, today, the national minister is in this province to launch the rollout of the NHI. The Act of 2003 is very clear when it says the National Department needs to establish clinic committees across provinces at each facility and clusters. So if the national minister is on a road show, but there's no community governance structure, and it's a serious concern because we've been struggling since 2003 to ensure that the national department gives the road mapping for clinic committees. Yet there's silence. But we have the rollout of the NHI where community leaders in the health sector is having to carry this message. So, on the rollout of the NHI, the tobacco law, and every other law, where is the governance structure for community representation in these sectors? That's question number 1. And then number 2. These schools, our children, just yesterday, the Valhalla Park Primary was under lockdown. They could not leave because community violence, gang violence actually, that we cannot control in this country, where our school children, 3 shot in Kraaifontein on Monday, 4 shot in Bishop Lavers and Valhalla Park, and there's a deafening silence in our country on gang violence perpetuating our schools. My question is, how do we collectively, because it doesn't exclude me, I have a responsibility, but how do we collectively ensure that the things that has worked are brought back? Previously, we could put communities under lockdown. CPFs were involved. Now, the police says to a mother, no, I cannot take your case because I cannot lock up the gangster. Where is the right to safety for our communities? My last question is the regulations of the Bella Act and the implementation thereof. Psychosocial support for our children in schools at the moment is deafening. I spoke to the Department of Education yesterday because there's services that can be rendered collectively. Because when you call on psychosocial support, you're possibly going to wait a day or 2, while there are services that can act and behave as first responders. And there I talk about chaplains that are in our communities, that can access the service and make the services available. How serious are this Parliament and the 7th administration around the safety of our children, ensuring children are in school? Because the very children that stoned the Philippi 3 school-going children. So they were supposed to be in school. What were they doing there? So we need to relook and revisit the constructive engagement of civil society in the implementation across sectors. Thank you.
Thank you. And number 3.
Thank you very much, Chair. I think my first question is going to marry with my chair's input in terms of safety at school. We're talking about safety. How often do you make sure that you are meeting with your governance structures like SGB to equip them as their parent coming from community to oversee in terms of safety in school? What Damaris has mentioned now, why don't you go back and do introspection or check what was working in terms of safety before, when there was Abo Bambanani and other things that we can revisit and check how to establish and check how do we do into safety in terms of minimizing what is happening. And because it's starting now in my area, Ekukuletu and New Crossroads, gang violence again between Abantwana Base Andile with Philippi. We know when we talk about the Philippi, what is happening. I think, man, it's good, the structures are there, but the monitoring and evaluation of those structures, are they effective? Are they working? The SGP, how to empower those SGPs that are governing ES Kolweni. Then in terms of undocumented child, I think Home Affairs can do it better in terms, we're not just talking about people that are coming over there. Don't want to say that name. But we also have a battle of undocumented children here in South Africa. And the issue of late registration of birth certificates, it takes so long. We know that there are procedures and processes that must be followed, but you have to revisit all those requirements, because it went Umtana Akali School in 5 to 7 years, still waiting for a birth certificate. So I think these departments are working together. These things have to look at. In terms of health, where my heart is, I'm a health committee nominated in Guguletu. Now, we've been waiting for letters of appointment. I don't know since when. We are operating, but things are moving. We are talking about issues of NHI now. When is the engagement going to take place in terms of engaging with the community participation in this, all these things? Because you know what, even myself, I was thinking when we talk about NHI, I will just march to a GMC or just march to a private hospital. We don't know about issues of the going to be process of the registration and all these things. When is going to be a community participation, the engagement with the community in terms of these things? We've been talking about NHI. When we talk about NHI, even address the community, the clinic, about stock out issues that are really eating the community. They think they have big head about NHI, thinking that if NHI is going to, our minister have already signed, I'm not impressed that the president has signed NHI. Where are the resources in our clinics? When is going to be a community engagement?
Okay.
Sure.
Thank you very much. We still have quite a number of hands to go through. The issues that we are raising are very important. So, but I just want us to confine us to the questions. I think questions will still be responded to. And I know that some of the issues, the chairpersons that are here might not be able to answer because they belong to other committees. So that's why we are rotating these committees so that you've got an opportunity to deal with a wide range of issues. So, but we said that those that we cannot deal with now, we will record them and then we will provide you responses. Okay, then we go to hand number 4, and I want one of the hands to surprise me by just being quick to the point questions.
Ndiyaxakwa ke mhlekazi because kuninzi and kubi. Kubi kwindawo esihlala kuzo molweni lo uthetha apha nguPamela kaPoison from Gugulethu Development Forum, also a SGB chairperson for disability children.
Surprised that even without going into great details of background and everything, the chairpersons already, in fact, have interfaced with that program, so they understand the context.
Okay.
So that's why if you,
Okay.
you just give the question, they will be able to respond.
Okay.
Yeah.
Okay. Heard ma'am, the last speaker saying the intervention that she made with CPF law enforcement and so forth, but I have not heard you touching in other interventions like City of Cape Town. The cities also had a pilot projects that they did, but there's a problem. They touch base for 3 months. They bring a problem that looks like a solution that can really work for us. For an example, Women for Change, that was doing the screening in the families, door to door handling, and then they get to know who's got ID, who does not have ID, who needs a grant, who does not need, and who needs assistance in terms of substance abuse. And also they had a walking bus, and also it was just on short-term basis. And I would say they recently now have neighborhood watchers who are called on that EPWP program as community ambassadors. They are the people who knows in the community who's doing distraction, who are the criminals. So if you going to come to the city and then you give them programs that are going to work for 3 months, for 6 months, that are not going to be long term, they are not going to be visible in our schools because we needed them, because there was a program in long time that was launched by the minister, I think Rama, in the schools. They were searching the bags, the dacha, you find a 12-year-old having a dacha, knife, scissors. Now the law enforcement is restricted to enter the school premises. They won't be able to search the school bags, but we know our neighborhood watchers, given the program back, for that is going to be long term for 2 years, because we've seen that if it comes from the national department, it works because it's a long term contract, either than 3 months or 6 months. And I want to ask, if this program, the problem of crime and all these other things, how far have you gone with your departmental social workers? Because you would find again, if we are given social workers, you are given one social worker that is going to service 6 schools, one psychologist that is going to service 4 schools. And when you bring reports and the problems, and you would find that social worker being exhausted, not being able to do all these things. And if we can have auxiliary social workers who are doing home visits, screen these children who are having anger problems, who are having other issues, so that we do not criminalize each and every child. Then we can go deeper to each child's issue, and then we can follow up with the department. And I will tell you, with the social workers that we have outside that are working for the province, for them to be inside the school premises, there's a boundary. They will tell us that the social worker from the Department of Education needs to adhere and attend to that. So we need service like that, if you can employ more social workers, give us auxiliary social workers, and extend the Women for Change program to be a long-term contract for 2 years. Thank you very much.
Thank you very much. And number 5.
Good afternoon, Chairperson. Ridwan Ahmed from the National Professional Teachers Organization of South Africa. Allow us to appreciate the inputs by the various chairpersons. Allow us to further echo and share the concern around the regulations, the 2 that was also only regulated, and certainly as a stakeholder, we will comment. Our concern is around the grade R and the infrastructure and funding. We would like to know whether there's any thought given to the in-migration as well as the equitable share in relation to the funding and infrastructure for grade R. We are very much aware that the practitioners are required. A mention was made of the qualifications and capacitation of our practitioners. We are very much aware that there's a concern around the qualifications of these practitioners. Our question therefore relates to, is there any attempt or investigation into securing the employment of these practitioners. Our sense is that if you are regarded as a practitioner in terms of the minimum requirements for teaching education qualification, the MRTech, that your services would be terminated. Thank you.
Thank you very much. 6.
Good morning. May I stand by the protocols of the meeting and appreciate the presentations by the chairpersons. I just have the three questions. The one is in relation to the engagement with Operation Dudula by the Parliament and also by the Ministry. And my question is, has there been scope for also inclusion of other civil society organizations within that space, just so that there's a balanced picture being given? And also, just in that context, it was really spoken to Dudula in Gauteng, but there's also March and the denial of access to health services in KZN. That is also a big concern. So just thought to flag that. Then the second thing is a question to the chairperson with respect to the response to those who've lost their documents in a fire, but there's also those who are not yet documented. Like we have children who don't have birth certificates. We have a lot of undocumented individuals, and then we have those that even documented but are still targeted. It's little known, but in the xenophobic attacks of 2008, 1/3 of those who were killed were South African nationals. And so my question is really, and what often happens is that those who are from ethnic minorities within South Africa are also the target of this kind of approach of trying to othering and refuse. So my question is, what is being done to address those who, to prevent these vigilantes from denying access to healthcare services, to education services, to those who are undocumented or seen differently? And inclusive of that is a lot of South Africans who might be from an ethnic minority who are also being targeted by such operations. And can an inclusive approach be taken? And then my last question is, just in terms of the engagement with CPFs, like your community policing forums, and ensuring safety at schools and things, is there scope for a very inclusive approach that is inclusive of refugees and migrants? And the last point is also to say, have the chairpersons looked to engage with the Department of Home Affairs, because a documented populace is a tax-paying populace, and that will help contribute to and also help with planning purposes in terms of access to schools, etc. So is there been engagement in terms of documentation, regularization of migrant populace, so that we can better plan and better work together and get better taxation? Thank you.
Okay. Hand number 7. I know that there are quite a number of issues relating to crime in schools. I know that the two chairpersons who are dealing with basic education and higher education are going to deal with it to the best extent that they can. But probably we will invite you again when we have on the panel the chairperson of the Portfolio Committee on Police, so that he can go into great detail on those issues. So he has already appeared in this panel 2 times, and we will be calling him again for the next engagement. So just to note that 7. Is it 7?
Right, Chair.
Questions?
Yebo.
Sure.
Good morning, everyone. It's just that, my name is Shabulela Monagali. I represent an organization called Illicit. It's just that it's very disappointing that the other chairperson is actually not here from the Committee of Women, Youth, and so forth. Saying that we are dealing with a scourge of violence against women and children. It is rather concerning that he or she is not here today, because we had so many questions that we wanted to ask regarding the National Council on GBV, in terms of the timelines that are set, in terms of it being operationalized. And the act itself was signed into law in May 2024. And in more than a year now, we haven't seen any form of action in terms of how it's going to be operationalized. And we also haven't seen any linkages in terms of how it will be linked to the NSP on GBVF. We are already facing a deficit with regards to the enforcement of the NSP on GBVF, particularly in communities that have high rates of violence. And the sad part is that we've come to a point now as a country, and particularly us as NGOs who are working in these communities, where we have to ask ourselves very critical questions in terms of our engagement with government. And just last week, I can see some of the colleagues that I went to the national dialogue with, and it leaves such a bitter taste in your mouth with regards to the type of engagements that we're having with government. How constructive are they? And the sad part is that, it's often just a talk shop. I heard earlier on with the other chairpersons talking about engaging with communities, but is there a particular willingness from government to actually listen to the communities themselves? And I think that is not there. Often when government speaks to civil society, when they speak to communities, they are speaking above them. They're not necessarily speaking to them. It's not a consultative process. So the urgency and willingness to listen to the grievances of the communities, I doubt that it's there, and it's really disappointing. I think it's more disappointing that the chairperson is not here, because we needed to highlight certain issues regarding how this act itself is going to be rolled out, because we need to operationalize it as of yesterday.
Sure.
If it was signed into law in May 2024, but yet to this day, in Women's Month 2025, more than a year, we still don't see anything that is materializing from it.
Okay. Now, I think what we'll do, like I said, we will take those comments and the questions from Illicit and others that relate to issues of children, women, youth, and persons with disabilities. Yes. So we'll take those. I think she would have wanted to be here. She said so. And it's just circumstances beyond her control and our control that she cannot be here. But we understand.
Can we have a session where we come back to this?
All right. Okay. So we will schedule her in the next one. That will do. And we'll give you also an opportunity at some point to give us feedback on the national dialogue, to report back on the national dialogue that you attended, so that all of us can be apprised of what transpired. Thank you. I think eight now. Is it 8? Yes.
Thank you, Chair, and thank you to the Chair of the Portfolio Committee as well. We appreciate the presentations that have been given to us. Chair, I would like to commend the Portfolio Committee on Health with the process with the tobacco and electronic delivery system bill, the public consultation process. This could have actually happened, I think, the taping could have happened in November already last year, but through NEDLEC and the listening to the plight of the industry, we were given an opportunity to work together at the end of last year, throughout the beginning of this year, and the public consultations continued. Chair, I would like to stress, however, that having listened to you stating that September is one of those critical months where the Department of Health would be taken through a clause-by-clause process where they would actually be asked to take into consideration their views and submissions of the public and interested stakeholders. Can I please ask that, as same as the previous gentleman, that this becomes a real consultative process, that the department is held to account, because clearly the bill cannot pass in its current format. The bill, even though the process started in 2023, a lot has happened in the sector where, in fact, there is a need to conduct a social economic impact study, given the fact that COVID has almost obliterated that industry, the legal industry. Secondly, now as we speak, tobacco, 60 to 70% of tobacco is illicit. What does that mean about the future of tobacco in this industry, the future of jobs? While we admit the need to balance health and economic imperatives, this industry is slowly actually dying, which means disinvestment, which means that jobs are going to be lost. And it is a legal product that we believe should actually be regulated appropriately. And speaking about appropriate regulations, the vaping industry as well needs to have regulations that are appropriate to them. So, Chair, ours is to say, please let's ensure that we have a fit for purpose bill, number one. Two, that the department is held to account. And three, Chair, I would like to propose that we look at illicit and counterfeit in its totality. If you look at tobacco, you look at liquor, it's about 22 to 23%. You look at pharmaceuticals now, you would be concerned that some of the pharmaceuticals are actually now illicit. We don't know what people are taking. Cosmetics industry, so I would like to appeal to Parliament and opening up the can that was opened by the Minister of Finance in his budget, where he said that resources are going to be dedicated to fighting illicit and counterfeit.
Okay.
Can we have stakeholders actually deal with that from that perspective, and we come with solutions and standards? My last contribution is that there are global standards, the GS1 standards, where tracking and tracing of products can be made possible so that we actually eliminate illicit and counterfeit. Thank you very much. And Chair, can I ask that just as we're talking about these bills, that we open up a session where we can talk about other matters that are very critical to the industry that we know about that are not tabled today, things like the health promotions levy and other things that we'd like to bring as an industry. This is a welcome session. Thank you very much.
Thank you very much. The chairpersons will return again. Is it 9 or 10?
Yeah,
9.
thanks, Chair.
Yeah.
Yeah, my name is Kangele and my surname is Mabulu, but family is SK. I'm coming from Sonke Gender Justice base in the Western Cape. I'm mindful that as much as we'll understand the frustration, which I cannot deny, that there is a lot of frustration when it comes to the health services in the Western Cape. People are going to choose, they even have an appointment system. So I cannot deny that we have a problem of the health system in our country, in particular in the Western Cape where I am. So, but I cannot support the incidents, accidents that were done by Operation Tutula. The organization is clear, saying that, for example, how do you then deny the access person not to get a treatment of TB? Because TB is going to be infect another person. So how do you do that? And as we know, all of us, that we have a problem of TB, especially in the conjuncted areas, mean to say the shacks, so people TB can spread more on those things. So we can't. Also, Sonke Gender Justice also think about the issue of gender-based violence. You see, watching the women and the children walking on top of the street because of these actions, then we really want to condemn. But I wanted also to bring you, Chair, on the issue of the safety in the school. I know we like singing the song, but it seems that there's a pinch in our brothers and sisters. Teachers, they don't actually know how to discipline the children. after the introduction of the school, corporal punishment down. They don't know what to do. If the child is cheeky in the school, bringing a knife, they only allow to suspend child for 7 days. You suspend the child for 7 days. And after that, the child is coming back to school and also suspend for another 7 days. And what to do after the 7 days? So we need to give guidance what to do in those incidents. Western Cape overcrowding in school. Instead of ratio 1 to 38 or 40 inside of the school, there's a ratio between 1 and 50. So we deal with a challenge in the Western Cape when it comes to that. And also the last thing from me, the violence in school is coming from the community, nothing else. So dealing with community violence will help the school and the social development coming to that. We want the social development to come where on the basics used to be very strong. I don't know what happened to social development. The services are far from the community, the people that need. I even went to Cape Gate. The office is very clean. You can see that there's no flow of the people, but problems are happening in the community. Thank you very much, Chair.
Thank you. The last one. Ben.
Thanks, Maloto. Lindsay Dentlinger, Eyewitness News. Firstly, to Dr. Dlomo, Action SA is taken issue with the health department's advertising of vaping, allegedly saying vaping is equally as bad as smoking, and it wants to lay a complaint about that. What is your view in terms of those particular ads while you are dealing with that tobacco bill? To Ms. Mamela, the Bella regulations, the outstanding 8 regulations, are you putting the minister to terms, and when do you want to get the rest of those regulations? When do you want to see the rest of them being published? And then to Chairperson Feni, I understand this does fall within your portfolio. In the last day and a half or so, we've again seen some controversy related to the appointment of CETA administrators under the new higher education minister. Is that something your committee will be probing? Thank you.
Thank you very much. Just a small one question, number 11.
Just very quickly, Darryl Swanepoel from the Inclusive Society Institute. I want to speak to the the foreigners in the country. We need to understand as a country, what is the actual quantum of the problem? We have numbers bandied around of 8 million, 13 million people in the country. I've seen 2 studies, one from Stats SA and one from the Human Sciences Research Council, which say there are 4 million foreign-born citizens in this country. 2 million illegal, 2 million legal. A 2 million problem is completely different to a 13 million problem. We need to understand the quantum. That's the first thing. The second thing is, it is not the role of civil society organizations, or for that matter, political parties, to enforce the law. It is the authorities must enforce the law. And we shouldn't entertain and consult with organizations that are breaking the law. There are processes, there's parliament, there's the executive that they can engage, there's protest action, but we cannot tolerate anarchy in this country where people, civil society organizations, take the law into their own hands. Thank you very much.
Thank you, Mr. Swanepoel. On that note, I'm going to give an opportunity to the chairpersons to respond. And depending on whether we still have time, because there are so many questions to deal with. One person asked 5 questions. So you can imagine that 10 times 5 is quite a lot of questions. So I also promising me, like Mr. Swanepoel, from here to here, quick, so that we don't leave anyone. This
Good day, everyone.
It's a month of women. If you are not a woman, please, I'm not going to take you.
Good morning.
Respect women.
Good day. I'm a second-year law student at the University of the Western Cape. My question is directed to the Portfolio Committee on Basic Education, because our speaker raised a concern about the grade R teachers not having the required qualifications. Right. So now, on the grounds of admission, because I do believe that the Bella Act refers to all learners, right? So basically, I want to ask, are there any measures taken in order to ensure that the disabled learners, after being admitted, are subjected to an environment that caters for their needs? Because this act itself does not refer to that. This is on the basis of qualifications. Is this something that is going to be taken to ensure that the teachers in those schools are able to cater for the needs, the special needs of those disabled children? Thank you.
Thank you very much. I know that you are getting provoked, but let's. I think there was a fair representation of diverse views of diverse sectors. So, if you don't get opportunity to ask, you still have an opportunity. It's not the last time that you are in Parliament. We'll want to see you coming back. We want to see you coming back. Yeah, I was very fair to start this side and there was no hand. And this side really embraced, took serious, opportunity, advantage of the opportunity. Just 10 seconds.
Thank you very much, Chair. I have one question and perhaps a solution for some of the questions that were going around. So,
yeah, but let's leave the responses to the chairpersons. I appreciate that you have got solutions because it might take us too long.
All right. So the one question is that 2 weeks back we had a grade 7 learner pass away in Gauteng because she had an asthma attack. So my question is, can we have people, not people, but accredited people to go around schools, especially in townships and rural areas, to teach teachers basic life support? Just a course so that, because if one teacher knew about basic life support or CPR, it could have saved the learner's life. So if you can just have people going around these basic school and teaching first aid kids and basic CPR for some students who might suffer from asthma attack, I think it would do great justice.
All right. 10 seconds.
Thank you very much, Chair Mzivelapi from Illicit News. My question is directed at Dr. Lomo. In comparison with the gentleman from the Select Committee on Education, Science and Creative Arts, why is it difficult for the Department of Health to take a strong stance in condemning the violence, the threats, as well as how Operation Tudula has taken control of public health care centers in Gauteng and also in KZN? Yeah, is this a reflection of perhaps of the views of the minister? This thing of not having a strong condemnation?
All right. Thank you very much. I'm going to allow the chairpersons to respond in the order that they made their presentations, starting with Honorable Dr. Droma.
You allow us to now comment from here, maybe starting from backwards. That's another viewpoint to have, to condemn, but the other viewpoint is to engage, as to what informs you to believe that you need to go to the hospitals and camp there and do what you do. And in fact, to answer another question, there are three institutions. One is March on March, which is prominent in KwaZulu-Natal, is Tudula, and the other one, they call themselves Progressive Forces of South Africa. So there was this discussion between myself and the minister, maybe let's find out and engage and actually assist them to say, this is not a way to go, even though you have concerns. And hence, those things we hope now are going to be attended to, because there is another speaker on the floor who also mentioned that besides blocking anybody on the doorstep of a hospital, thinking that is a foreign national, you may be blocking a legitimate South African, because not all of us, there are still South Africans who are undocumented for various reasons. By the way, before I go and expand on that, to actually assist the communities, Home Affairs, by the way, has got many offices now in various institutions in the country of hospitals. If you do give birth, they actually find a mother where say it's a B&B, a birth and a birth certificate. So mothers go home with both the birth certificate with the baby. They are also beginning now to say, can we also cut down most deaths happen in hospitals to assist those home affairs offices now can even issue death certificates in there. So it's a lot of collaboration that has been there between that. So without digressing too much, we are saying we give a benefit of doubt that you are blocking someone who's a legitimate citizen in this country who actually has to be in the hospital but has no documents because of various scenarios that could happen. Undocumented, is late to register and the documents have been bent down, so don't go that route. Number two, based on the first question of the speaker from Molosongololo that says, United Nations has expectations from all of us in the world that you do citizens, you actually, so you engage through those discussions and educate. And therefore, on the basis of the discussions that are ongoing with them, we hope that these three institutions now would understand that approaching this matter the way they have done to go to hospitals and remove is not a way to go. But that engagement, we thought it had merit and it assisted in actually dealing with that process, rather than to say, do this and this. So some of them may not have been aware. They just see the anger of saying people are not having enough medication, therefore let's do this way and do this way. So we are actually saying an absence of a document into a hospital should not allow you to block any individual, and therefore that vigilantism is actually, so we think that educational sessions that has happened is important. But however, we are saying Department of Health, engage quickly with the Department of Home Affairs to fast track some of those acts that you think must be repealed to assist you to do 1, 2, 3, 4. And therefore those processes should kick in also to give us going forward. Now, on the speaker regarding the illicit trade, I want to say, listening to many presentations as a portfolio committee chair and the committee, we firstly ask people, illicit trade is not a phenomenon in South Africa alone. So South Africa, together with other countries, must actually, globalization has opened up space for illicit trade. But there's something else that colleagues here should understand and appreciate. I've learned this over the past 2 years, that there are legal manufacturers and traders of tobacco by the day, and there are the illegal by the night. They are South Africans. There was a time when the borders of this country were closed on the and there was no tobacco coming in from the borders because everything was closed, but there was a shooting up of people who were using illicit. Illicit was coming in down from within our own. So people are actually saying, how do I avoid paying tax? Let me trade during the day and guarantee that I pay tax, and at night I do illicit trade. So let's not look very far. The industry itself is aware that there are people who are doing a double dipping. They are doing trade by the day legally, and they are doing illicit by night. So don't look around and say we're waiting to get people from Colombia, from any other parts of the world to bring illicit. It starts here in the country. It's done by people who are legally trading during the day and they decide to trade differently at night. Now, there is something that is there in our constitution, with some of us feeling very great that a document called the Freedom Charter 1955 has incorporated quite a lot of what is in that as clauses into our constitution, where it says the South Africa belongs to all of us who live in it. The first clause there that comes in talks about the people shall govern. Now, we should really reflect on that. What is that? Among other things, there's a member who talks about the absence of representation. You know, when they talk about the clinic committee, whenever anyone asks me about challenges around where they live, I said, what's the response of the members of the clinic committee around where you live? What's the response of the members of the hospital board around where you live? What are the issues that are taken up by the school governing bodies, SGBs, and also the the policing forum. So these are structures that must actually guide and know of citizens in this country who go and say, Clinic A is not going to survive because if I'm not there as a clinic committee member to support the marshalling the queues, so you then come to know those things and also the medication not there. So those are structures to govern ourselves. You can't wait for, and I'm saying this because in the previous life, I was once at MEC for Health. I did not go around establishing clinic committees, but in my desk, I would receive documents to say, in that committee of Kailisha Kukuletu, in that committee of Mbumbulu, members of the committee met and they discussed and they agreed that these are the members who will represent them as clinic committees. Please sign here. And then I now know there are delays in terms of those signing papers. These structures are created by ourselves in the communities so that you can hold clinics and hospitals and schools accountable to yourselves to know that you not generalize. Say, is Sister Peters in our clinic who doesn't come on time to work, comes at late at night and all those issues. So those are things that we are actually thinking must come back. On the issues of NHI and the delays, you probably might know that there are about 6 institutions and people who have taken the government to court on the implementation of the NHI. We are asking the government not to hold back and not continue with processes related to the governance structure that must be set up on NHI while they are preparing to go to court and deal with those issues. So these issues are there. They will always be there, but it must not hold them back in terms of the processes. I think the last but one question who said I'm going to come with the answer, with the question and solutions is probably, and is related to some of the things that are not there. Teachers may not be able to assist if they don't have information. This is the Mofokeng family that must say, by the way, our child have got asthma. And we give asthma treatment in the morning when they leave home. And then midday, they must also take this asthma tablet. And it goes to the principal's office or someplace there to assist. But over and above that, I know health has supported education by having structures called school health nurses. School health nurses they may not be every hour in every school, but the availability of school health nurses is actually recognizing that educators may not have all the advantages of understanding health, and the visiting of school health nurses, highly professional, will assist us to really cushion us in terms of social challenges. So it may not be happening as you would have wanted to, but there's always a presence of school health nurses in the provinces and in all our clinics and hospitals that we have. I thought maybe those were the ones that were maybe expected to be done by. Yes, so the issues of, yes, Western Cape and every else blocking it. So we are actually saying we hope that this engagement with Tutula, March and March, Progressive Force of South Africa will now cool down in terms of, because now they do understand that they are disadvantaging even people who are eligible, even if they had an issue which we are needing to address. But United Nations does not allow us to discriminate in terms of at least emergency health services. So all those things you need to engage people and make them understand and therefore take it from there. So we hope that they will actually be able to understand those approaches, and then the issues of them blocking hospitals now will not be an ongoing process. Thank you very much.
Thank you very much. Thank you very much, Chairperson, and also thanks the questions and also the suggestions that were given so that we move forward as with confidence indeed that at least on the issues that we are having discomfort with, we are also having the support now of the communities who are truly representing their communities. The question on how to enforce, I think it's Songololo, the decisive response on the threats. I think we're clear as a select committee that hence we're saying that if our engagements, because we are creating a platform of engagement as a select committee with civil society organizations that might have the same view of feeling on how to approach the question of school admissions, specifically on foreign nationals. If the after engagements there is no consensus, then law enforcement agencies will take its course. As it was the case, I think Honorable Chair is falling short of raising that there were people that were arrested. When they were trying to disrupt the health processes and were released on warning. It was a clear indication now of being decisive. You engage, but you arrive at a particular stage of saying, if we are not going to cooperate, then we are going to take decisive actions now. So it's what we are going to be doing also. It's not the question of just making noise, but it's the question of trying to accommodate where we can. But if we're failing, if we do not reach a consensus, then decisive actions will be taken, but it can't be something that we're putting, first to say we are going to arrest people who are disrupting, but we are going to create that environment. The question of violence in our schools, indeed is informed by the violence in our communities where we are staying. The unfortunate part is that no one wants to take responsibility of this, of these inactions sometimes, because we know who are these people who are committing these, crimes in our communities, but we are refusing or we're afraid to deal with these criminals. So the cooperation, once again, is going to assist the formulation of the constitution of street committees, your safety committees in our society that are going to be your CPFs. It's critical to have those structures so that when we deal with the question of schools now, we know that at least we do have measures in our societies, that are going to be able to be working with your stakeholders at school. Because if we do not have stakeholders in our communities, schools are not ivory, or island where they are operating outside of their communities. Any challenge that we are confronted with in a society, we will be lying if we are saying that no, we will be addressing it at schools. If your child at school, at home, you cannot be able to reprimand your child on smaller things that they are doing, you cannot expect that they are going to be perfected at school. The teachers need support. So that support between the parents, hence we are having your management, at school, management school at school level, your governing bodies, regulated, that is, your current legislation now, your Bella Act is explicit of what actions can be taken if a child now becomes, the actions of the child are beyond, the reproach of the management of the school, then it's explicit on that. But the legislation itself is trying to encapsulate all the necessary actions so that you do not get different, interventions at different levels. So it begins to address this outcry. Indeed, also that the police themselves, if they are arresting someone here, and then you do not want to go and then make statements or witness at court, that arrest is useless, because for those people to face the full might of the law, there must be a cooperation again. So that is why government is I'm talking now at the level of the Department of Safety and Security. There are processes and there are platforms, and also there are, means that are there. But at school level, you cannot fight gangsterism alone without the society, without society. The violence, the selling of drugs, those drugs are not manufactured at school. They are coming from our communities, which therefore means that enforcement now will be, a two-pronged approach, not only expected to, the teachers must teach, and then any other thing that is expected from them must be a support from the community. That is why, as a select committee, we are calling upon our society, your parents, any stakeholder in a society, to come closer to work with our school government bodies, so that environment of the teaching environment becomes conducive for that specific purpose. On the question now of the commitment, specifically on the introduction of grade R's in our schools, on the side of government, in terms of the budget that 2025-26 financial year, an amount of 100 million is allocated specifically for infrastructure. When we talk infrastructure, you talk the question of classroom, the question of accommodating those children with disabilities that are going to be introduced, so that the environment that is created for them to be able to start them. And then on the question now of your teachers, how do you call, I forgot how to call it, but those that are responsible for these learners, a 10 billion is for that, for that particular reason, for various, aspects of this introduction. You empower, you capacitate, your teachers, so that they are ready, and also they are responding, to this, introduction of your grade R. So there are means that are put at play, but, by government. But the question of facilitating them to different school needs, will be, of course, the sole responsibilities now of the department in ensuring that this becomes a reality. Comes 2026, we are no longer having, this doubt of whether this can happen or not. But I know that change is difficult. But once you become part of change, then it's something that we all appreciate. On the question of vigilantism, I think it's what we are raising, that this is a country with law. Anarchy is anarchy. That cannot be accepted in any sector of our society. We can't. That is why we are saying, even in communities, we do not accept people to take the law in their own hands. So I think it's informed by, by that call. It's a clarion call to all our citizens, not even to accept or to allow that, because violence against violence will never bring. We do not want to have a situation of a civil war in our own country. But these legislation that are meant to address these questions, if you are talking about the question of your border management authority, let us cooperate. We must not form part of those people who are corrupting the system, because if we are corrupting the system, we might be defeating the end, result of that. And then it becomes now an outcry, a challenge to all of us, that government measures that are put in place are no longer there. And also the question of overcrowding, it is a moving target. You will never have a situation of saying that I've dealt with it. Remember, it is coupled with your socio-economic challenges. Today, better, you know, you know, in Western Cape, because of there is a development that is taking place. Tomorrow is moving to Gauteng. Remember, it used to be Gauteng where you know, migration of workers from different areas of our country, from different provinces, you know. You are still having that challenge, but it moves with demands and also the opportunities. In as much as we are addressing it, tomorrow is going to be on another place. But on the side of our system, hence we're saying that let us there was an introduction now of applications earlier so that we can understand which school, which challenges, you know, as we're on the oversight in Gauteng. That's what we discovered. The question of infrastructure, if that is not being put to the fore so that we can be able to address the infrastructural challenges, your human resources, you know, and better schooling sometimes. Not that you do not have, you know, infrastructure, but also the question of your barriers in admissions, because the question of race is still there. Certain demographics are not being accepted in a particular. We know the cases that we encountered to certain schools, whether they are in the means of excessive registration or excessive, you know, schooling. So those are the challenges that we need to address, as you know, but government processes are there to ensure that we respond to those. Hence, we are putting a clarion call to ourselves as we are currently doing it. It's a dialogue on itself that we are currently having as we are getting the necessary suggestions. Other issues I think were means to empower us. I think I've tried to respond. Those that I haven't managed to capture, then we will do so in the form of writing, as the chairperson has suggested. Thank you very much.
Yeah, now I was going to suggest that because there's a big screen there. That's a thing.
Thank you very much, and thank you for the questions, the deliberations. I think the presence of stakeholders is very important, and we were getting a lot of engagements from stakeholders based on their own experiences working in the different sectors. The first one I wanted to address is the gentleman that spoke about your interface with government and how you feel it's actually a futile exercise. It's a talk show. And in our response, we should make it clear, because some of these questions you could hear that it is a call to us as a legislative arm, because our role as members or as parliament is to hold the executive to account, is to play oversight on the work of the executive. So they implement these policies, they implement and they spend or they allocate resources or budget to different programs. Our role is to ensure that that budget is spent efficiently and effectively, and that they implement what they have committed to implement. So we want to assure you that your engagements with Parliament is not a talk show. Many of the work that we do, 80% of the work that we do on holding the executive to account is actually informed by deliberations with the public, because we're not in the public. So we don't stay, for example, in Inyanga or Khayelitsha, we're not there. But through our engagements with community members, community leaders, we're able to then ask questions to the Department of for example, basic education in the Western Cape and say, can you account on these issues? We are told that there is overcrowding. What is your plan to deal with overcrowding? And that is informed by our engagements with yourselves. So don't ever feel that it is a futile exercise. It's not. It's not a talk show from our side as Parliament, as the legislative arm of the state. Now I'm going to respond to specific questions. The issue of the Bella Act and psychosocial support, I agree. That is a fact. It is a fact that the allocation of social workers to schools, and that is what we've also witnessed, is that one social worker is responsible for even more than 6 schools, especially in areas, in your rural areas, in your townships, where there is a high number of schools, where there is a maybe limited number of social workers that are working or attached to a certain clinic. So that is an issue that we've raised with the department. It is correct, the correct reflection to say when you have such social workers, the workload becomes so much. And some of them even visit a school once in about 3 months. And that does not assist the situation. It is correct what Honorable Dlomo has said. There is one school that we visited in the Northwest. There is a stationed nurse in that school, and we're very happy about that. And in fact, when we asked the teachers and the learners about the impact of that stationed nurse in the school, the teachers actually said, we used to have a high rate of teenage pregnancy in this school. At the current moment, it has reduced to at least 2% because of the presence of that nurse. So it's correct that there is schools where you've got that, but where we are seated, we ought to ensure that we engage with the department on how do they expand that. At least we should have schools that we target, that we say these schools, we've got this number of issues. And as a result, we need a full-time stationed sort of a psychosocial station where you can have a social worker, you can have a nurse. So we've seen that model, and that school was saying it works. And if it works, then we should actually see how do we enhance that model. And then you go to the issue of how often are we meeting with SGPs? As I said, we're a legislative arm. So we engage with SGPs, we engage also with the department. And the last meeting we had, 2 meetings ago of the portfolio committee, we invited all the SGP organizations at either national level or provincial level with the Department of Basic Education. And the reason we invited the 2 stakeholders was that we also noticed when we did oversight that school governance is done by SGPs. And some of these SGPs don't have capacity. For example, when we speak about school infrastructure, there is an allocation to each and every school, maintenance and repairs allocation. You go to a school, glasses are broken, doors are broken, just a handle. There is a budget. There's a budget allocated, but the SGP does not have capacity to utilize that budget. So the school deteriorates even further. So we had a meeting with them to say, you need to really enhance your training and your capacity programs of SGPs, because for them to really govern the schools effectively, you ought to ensure that you capacitate them. So we agree that there is an issue of capacity of SGPs because governance has become complex for everyone. So you need to really run a program that capacitates SGPs, and that from your engagements now includes how do you capacitate them to deal with safety issues in the school? How do you capacitate them to enforce code of conduct, for example, which is what the Bella Act now speaks about on issues of discipline of learners? How do you create a culture of respect for learners, for each other, and also for their teachers? We can't say that bringing corporal punishment back is a way to go. No, it's not. Corporal punishment is backward, it's narrow as a form of punishment. But we need to find methods and mechanisms to discipline our children and to ensure that we work together as parents, through the SGP, of course, and teachers on creating or coming up with new discipline mechanisms that our children are going to adhere to. So we're saying that we've recognized those gaps and we're engaging frequently with the department to deal with such gaps. Okay, the issue of undocumented children, I think it has been dealt with. The city of Cape Town and the programs will engage with the Department of Western Cape on the many programs, because you're saying there were programs that they had put in place, and in terms of your own reflection, these programs were impactful. And we are going to say to them, give us an evaluation of these programs that you've undertaken. The problem is that you are undertaking programs and you are developing them for only 3 months, and as a result, the results or the successes of these programs are not necessarily realized on the ground. We will also speak to the National Department, DBE, on some of these programs that were mentioned, that are impactful, because we do need to deal with the issue of the school safety as a matter of agency. As a result, in the Northern Cape, for example, it is part and parcel of the factors that contributes to a high level of school dropouts, of our children who drop out of schools. I was making an example that there is a learner in Limpopo who actually committed suicide after being bullied in school. So there's a lot there's a learner that we lost, I think was in the Free State or in Gauteng, who was stabbed at school. Now imagine a parent taking their learner their child to school, and then that child is stabbed in school. So it's a matter that we must deal with as a matter of agency, and all other recommendations are very important for us to engage with the executive to see how we can implement them. I mean, even with the SEPs, we were told that there is a COP attached to each and every school. But when you engage with the schools, and the experience of the schools is that COP will come after some time, because some police stations are very far from some of the schools. So they will come once in about 6 months, and you don't see the impact of that attachment. So we need to have a robust engagement with both departments on how do we come up with a program that works, not because we're trying to tick boxes, but something that really has an impact on the ground. We see results of these programs. The issue of Grade R and the Bella Act, did we consider the in-migration and equitable share? By the way, many provinces have been implementing Grade R even prior the signing of the Bella Act. I know that in Limpopo, where I'm from, in that village, Grade R was implemented way before. Even before the act was put into place, there was a time where I think the minister was still Minister Pando, who signed some form of a regulation that regulated the admission of Grade R. And this was the reason. It's very important. Early childhood development is very important. In poor backgrounds and poor communities, parents do not afford to take their learners or their children to creche or to preschool. As a result, they only wait until the child is of a school-going age and they go to school or to Grade 1, because they don't have to pay school fees. And then the child misses out of 3 years of learning, serious cognitive development of a child, and they miss that out. So the reception grade then was meant to really augment and assist communities in that regard. Now, if you speak about equitable share, I'm glad Honorable Chairperson Feni spoke to the allocation that has been made. And we're not saying the allocation is enough, by the way. We said to the department, you need to come to us and tell us where are the gaps in terms of the current funding, because other provinces are saying there is no such crisis with Grade R admissions because we've been doing it. Actually, our observation was that the crisis is in the Western Cape. It's in the Western Cape where there was a highest number of learners in Grade R who were not placed or admitted to schools, because here in the Western Cape, the attitude of the department here was that we don't agree with the fact that Grade R should be compulsory. So Grade R was offered by different centers. And as a result, they've got a crisis of placement of these Grade R learners at the current moment. But in other provinces, it's not a crisis. They've been doing it. They're saying we don't have such a crisis. The issue that I agree it is a challenge is the Grade R practitioners and their capacity. In our engagements with the department, we were very clear. A Grade R practitioner that has full qualifications must be employed as a full teacher. So they must be remunerated at the level of a teacher, employed as a teacher. It is those that are still practitioners that are still undergoing the process of training, and majority of them in various provinces. I know it's only 2 provinces, which is I think it's Limpopo and Eastern Cape, where the number of practitioners that have enrolled in a capacity building program is a little bit lower than other provinces, but they are also picking up. So the departments are already where we are seated. They are already demonstrating that they are implementing a plan to ensure that all our practitioners are qualified. What, of course, we would not, because it's a very sensitive discussion, you would not want the department to say, now that we want qualified practitioners, those that were in the system must all of them go out. That wouldn't be a correct approach. And that is why we said the approach should be you must capacitate them when they're still within the system until to a point where they are fully capacitated. And that goes along with ECD practitioners, because we are also placing ECD at the center of this department's work because it was migrated. So it also goes along with the ECD practitioners. The issue of overcrowding in schools in the Western Cape, we've also noticed that. We did our oversight in this province. We went to Khayelitsha, I think it's Joslovo High School, and there were more than 80 learners in class. And this is a technical school where these learners must actually go to a workshop. That is just unworkable. And we've raised this thing sharply with the PD of the Western Cape. For us as Parliament and representing parents, the departments must come to us and give us a plan on how they're going to deal with this overcrowding. Because the fact of the matter is that the overcrowding is in your historically disadvantaged communities. If you go to your former Middle C schools that serves a certain communities, there is no overcrowding. So you find 15 learners to 1 teacher, and these are public schools. But you go to a Black community, there's 80 or 90 learners to 1 teacher in a class. So we've engaged with the FFC because we said we need to interrogate the funding model as well. Because where we are seated, and I'll give a simple example. The current funding model is that per learner we are spending about 5,000 in a quintile 1 school, for example. In a quintile 4 school, you spend, let's say, 800 or 2,000 as government, but the parents pay. So because the parents pay per learner per year, there is a spending or an expenditure of about 60,000. That is how you will see the inequalities. Really, that's how you perpetuate the inequalities, because the expenditure per learner differs. And as a result, there will be quality in not necessarily the curriculum, but the environment, and as opposed to your school in your townships. And it is mostly in townships. So in your rural areas, the migration trends is that people are moving away from the rural areas. So government at a certain stage built many schools in rural areas as a manner or as a means to intervene because there were no schools. Now those schools are white elephants because the community is moving towards the cities. Now in townships, that's where you find the issue of overcrowding, and it is a crisis. We even said to the departments, if it means you must bring temporary classes, you must then bring temporary classes, and as you are still planning, because that is not a conducive environment for a learner to learn. Even a teacher can't really give attention to a learner when there's 90 learners in class. Some of the teachers say, it is so hot in this class, it is so full that I can't even move in between the desks. And that also does not create a good working environment for the teachers themselves. So it does not present a good learning environment as well. So we're saying, yes, there is a cases of overcrowding in the Western Cape that we have seen, not only in the Western Cape, but mostly here and mostly in your township schools. I'm not going to speak about the violence in the schools because I think the Honorable Fanny has really spoken to that. I fully will take that suggestion about the capacity of teachers, which I think Teachers, where they are already, they will say to us, there's a lot of work and there's a lot of responsibility that is placed on them. And I agree with Honorable Tlomo that we might have to look at another dispensation as it speaks to emergency training and services. I mean, we have, for example, the program on teachers' assistance, a very important program. You can look at how do you bring community workers, community health workers to assign to schools to assist with such because the role we want teachers to focus on the curriculum delivery, teaching, and the learners. The last one will be, when are we expecting the rest of the regulations? We expected the rest of the regulations in June already. It's August, there's only 2. So where we are standing is that those regulations must be gazetted, all of them in totality, as soon as possible, because they were supposed to have been gazetted by June. The last one really is a matter that we're speaking about of resources and grade R teachers, that the ELRC, I think in May already, took a decision to conduct a teacher's head count. I know it's a matter that is on the media a lot now, and others are pretending, because they like doing that, as if it is their brainchild. They are doing something that is extraordinary. And it's not their brainchild. It is not even their program. It's actually teachers union, the 9 departments, and led by the DG some time ago, to say, because of the budget constraints and the fact that there's teachers post provisioning, so some teachers have to be released from the system. Can we conduct a teacher's head count, because they might be in the system ghost teachers? And we are one of the things that we must say as a portfolio committee is that we welcome this, and we are very excited about the results, because indeed, that for us, it's a very good intervention by the unions, by this council, education council. And we believe that the results of this intervention, because it's also funded by themselves, funded by the ELRC, the results of this probe, it's going to really open up space, and it's going to really ensure that teachers who are outside the system are also employed, because we'll be able to clean the system. I thought I should leave it here. If there is any other issue I have left, I apologize. Thank you very much, Chairperson.
No, I can confirm, Chairperson, that there is no matter that you left out. I can see by the agreement and the nodding of everyone present that the issues that were raised have been addressed fully by all the chairpersons, and I wish to thank the chairpersons for their presentations and engagement, and thank the members of our friends, the stakeholders that are here for, because I'm always impressed by the discipline of the stakeholders and their interest on these issues that are before Parliament. You never get stakeholders, standing up and leaving before the engagement is actually done. And that is always very inspiring. And even when we invite you, you come in your numbers. And we hope that these engagements are useful. And like I'm saying, we are not going to resolve all the issues, the problems of the country in one session. It's an ongoing session. And I think because we started these engagements, intensifying them in this current term of Parliament, the 7th Parliament, we are now in the 2nd year of these engagements since the elections last year. So we should be able to look back 5 years from now and say, what impact have we made on these issues? And hoping, and we are working very hard to make sure that these are not talk shops. These are not just talk shops. They are really going to an extent that the issues that are being raised, there are the oversight committees, which are for the only institution with constitutional responsibility, obligation to interrogate and to hold to account not only government department, but a wide various sectors of our society. They are able to take these things, and I know that an impact will be made by the time we look back 5 years from now to say that this is what Parliament has done. But I wish to thank you very much. I wish that as we adjourn, you don't just leave quickly. You engage with the chairperson, they are here. And then there is lunch as well. It's important that you get something to eat, otherwise it will be a fruitless expenditure. And next time you will come and also ask question about the expenditure that was not used properly. So help us to be compliant with the AG by nourishing yourself. But thank you very much for your presence. The cluster briefing is adjourned.